listening to Preston and Steve. MMR rocks now.
No, I have a question that my mom wants me to ask you, but what do you say? We've heard you say that you peak women, I guess, their childbearing years are in their 20s. So what do you say to women who are over 30 and still haven't had any kids?
Well, Mom, you're right. You get going. Here's the issue, and I don't skirt around this topic. By the way, in medicine, when we don't tell people the truth, they die.
Yeah.
So culturally,
same in radio.
Yeah. Everyone's choking.
Good Lord, there are a lot of
dead people.
Is there a doctor here? That's right. Your peak time of making a child is in the 20s because it's a time when your chemistry is the best suited. That incredible mixture of different sounds that have to come from your hormones in order to make a child. And so, if one of those falls out of whack because as you're getting older, your hormones aren't quite as reliable, it becomes a cacophony instead of a symphony of hormones. And so, for most women, they should at least think about the benefit of having a child before the age of 35. Once you pass the age of 35, the complications for both the child and the mom start to increase. Not a lot, but they begin to increase enough that we start to see a lot of folks having to go get fertility treatments. So I think we should set up a marriage counseling setup.
I agree.
Well, what do you think about
she's got a couple years.
What do you think about the fertility treatments, though?
Fertility treatments are very effective, but they are expensive, and there are complications like having 8 children at once.
Right.
Where do
you stand on something like that? I mean, that's excessive.
I did an Oprah show on this. That's an embarrassment for me as a physician. We have a civic responsibility to speak out on these topics, and we don't do it enough. That fellow is going to lose his license, but you have an obligation as a doctor to not do what your patient tells you to do, but to sort of get them to see the light so they understand what's important for them to do. And they can't force them. But in this setting in particular, I would have actually decided, I would have fired the patient. I would have said, "Guy, I've explained what I got to do. I'm going to offer you some other choices, but it is not fair to the children that you're bearing to have 8 at once because those kids, some of them, are going to have permanent birth defects that they will carry through their life."
Yeah.
So, I think it's not about her, it's about them. And that's a form of child abuse to me.
Quickly, you mentioned hormones, and I know that there's a big thing catching on now. I guess it's starting to hit a stride about hormone replacement therapies and things of that nature. I guess it's the science of youth, of maintaining your youth.
Yeah.
Is there a point to that? Is there in fact something?
When done right, it's essential. Let me give you a couple examples. A lot of the women out there listening who are in their 40s, early 40s, are already starting to see reduction in progesterone. Progesterone is not estrogen, but it goes along with it. And when you're pregnant, your progesterone goes skyrocketing high. Why? Because it bathes your brain in a Valium-like substance that allows you to stay calm in the face of this big belly growth that's affecting your life. When you lose the progesterone in your 40s, you lose that Valium-like effect. So the small things you used to overlook, the little slights, the things that have always bothered you, now become a big issue for you because you're no longer able to block it out chemically. So women actually become much more irritable as they get older for that reason. And as those hormonal shifts continue, they begin to develop a male mind.
Is it possible that someone has been born without that completely?
Yes. Kathy, he's looking at you, Kathy.
All right. Well, 2 things. We have 2 semi-medical oddities here in our studios, and we're going to do an examination. Dr. Oz, I hope you don't mind.
Please.
We want to see if you've ever seen a uvula as big as Nick's before. So go over there, Nick.
So, just for everybody out there, the uvula is in the rectum. Rectum, Jordan killed him.
It's one of our favorite jokes, brother.
See if he has a larger. You want a Sharpie as a tongue depressor? I can give you that. Here you go.
All right. Apparently, it's an ungodly big uvula.
Is this really happening?
What's going on in there?
Well, so I went in for a sleep study about a month ago, and they said that A, you've gained weight, B, your parents have a history of sleep apnea, and C, you have a large uvula.
So your uvula, the uvula is a little thing in the back of your throat that's hanging down.
The punching bag.
Like a punching bag in the back of the mouth. Mm-hmm. You have a very arched area, a tissue that goes to the uvula. So the uvula itself isn't as large as a lot of people's, but the tissue around it is much fuller. So that will collapse when you fall asleep as your muscles relax, and you'll sound like a kazoo.
Yeah.
So it's important for someone like you to stay super thin, or else you will quickly develop sleep apnea.
Man.
But Doctor, listen to some of the sounds. Like he'll be talking, and this is a sound that he made just while speaking.
Yeah. That's not his tongue. That's something in the back of his throat.
The uvula is literally like a little pop, and a pop gun.
Yeah,
that closes off the airway.
It's a recent development too. I mean, I've been doing the show for 5 years, and all of these sounds that these guys have, all within the last year.
Yeah, there's a bunch of them actually that we have.
They're really, really gross.
Here's another one. Him saying, "Yeah," but he.
No, that's not. That's not a
So, do you think it is from his uvula?
For you, it could be, and
the
there's
tissue
actually a
around it.
procedure that is done to just trim a little bit of that extra tissue that's sort of soft and flapping down.
I've heard the two different procedures are possible. One is that one, and then the other one is just complete. You can have it removed, but that procedure is painful and a long recovery.
Yeah, I don't think I'd remove the whole thing.
Okay.
I would probably trim that tissue down on the side, and that can be done, but without a lot of risk.
Thank you, Dr.
And by the way,
House.
for a lot of folks out there, sleep apnea, which is a big problem in America, if your loved one's snoring and they're going like this, right? That means they've got sleep apnea because they're, it's like a series of car head-on collisions all night long as you wake up a couple hundred times. When you don't sleep, you don't reboot your brain. It wreaks havoc with your sex life.
It's bad all the way around.
But it also causes heart disease. So
Yeah.
that's probably that for a lot of folks who are having issues, they sometimes need to be at least seen by an ENT doc who can make the same diagnosis you've got.
Okay. Can I give you a hug now?
Oh yeah.
And then
He got picked up by Fabio, too.
and then the other one, we have Casey's mystery armpit bump.
All right.
That's not a mystery.
Well,
All right, let's explain to Dr. Oz story. He has a little bit of the case history here.
Yeah, Casey thinks that he has this recurring, I don't know what it is, little miniature
It's
boil or
an
something like
opened
that.
sweat gland that I think gets clogged with deodorant.
Let me see. It's coming over.
He thinks that when he squeezes it, deodorant comes
So
out
in case
of
he's
it.
walking over here, a couple of things. Deodorants I'm okay with in general because I don't mind people smelling good.
Yeah.
But antiperspirants I don't like to use too much.
So
because-
just regular deodorant?
yeah, regular deodorant without the antiperspirant. The antiperspirant has always has some aluminum. Oh yeah,
Yeah, right there.
yeah. Yeah, but that is a sebaceous cyst.
That's a sebaceous cyst. It's from Star Wars.
Yeah.
Is it going to kill me, though?
Yeah, no, it's not going to kill you. If it has gotten infected a couple times.
No, it just gets filled up and then I milk it.
Yeah, it's a sebaceous cyst.
Yeah.
It's easy to take out. It's a local procedure. If it's getting bothersome for you or if it's painful at all, then take it out. Otherwise, leave it be.
Yeah,
There you go.
So,
And there you go. Does that make you feel better?
Yeah, I never really felt
Ask him
bad
about your polyp.
when I first felt it, I was like, "Oh my god, I got armpit cancer!"
Right.
And then I went and they said it wasn't anything big, so I just milk it
All
from
right,
time to time.
Casey, turn and cough, please.
Yeah. No, I'm pretty unhealthy, so can we talk for a little bit?